So my first test is a passive hip hyperflexion test. All we're going to do is push the knee towards the nose. I like to look at my patient's face to make sure that I'm not causing excessive hip pain, because there's no sense in causing excessive pain with any of these tests, but you can tell whether your patient has some pain or discomfort as you bring their knee towards their nose. If it's painful, that's considered a positive test. Next, I like to do a Scours test with the legs slightly abducted, externally rotated, and then bringing the knee up, and you're going to adduct the knee across the body, scouring the femoral neck around the rim of the acetabulum. So many times with Scours test, it's great for labrum pathology because we're irritating the labrum on the edge of the socket. Next test is an impingement test, which also, whether hip flexor or labrum pathology, is usually positive. I'm going to provide an axial load through the knee and then slightly adduct the knee across the body and internally rotate the thigh for impingement test, or a flexion adduction internal rotation, FADIR test, and that usually is positive in the setting of anterior hip impingement, labrum pathology, or psoas tendinitis bursitis. Now my different muscle tests here. First test is called Ludlow test. You'll pull your knee towards your nose, testing mostly hip flexor for hip flexor tendinitis or bursitis, and usually that will elicit pain. Even labrum pathology, other things can cause pain with that test, so it's not too specific, but this test tends to isolate the hip flexor more than other hip flexor muscles. And then I'll do a stretch, Faber, flexion abduction and external rotation, and we'll just let the knee fall towards the bed as we stretch the hip, again just looking for any irritability. And you can also have, so that's my Faber stretch, or you can do a resisted Faber. So I would like for you to try to pull your knee across your body and see if that seems to elicit any pain at all. That can be hip flexor, labrum pathology, rectus femoris, sometimes adductors as well. And then Stinchfield's test tends to isolate your rectus femoris more than other hip flexor muscles. So what you do is get your patient into a full extended knee, slightly flexed. I ask my patient to hold their leg in this position and don't let me push their foot towards the bed, and that will isolate that quadricep rectus femoris muscle to see if that elicits more pain in the front of the hip than other tests. One additional test, if you're really concerned about hip flexor tendinitis, you can perform a psoas stretch test. So I will have my patient slide towards the very edge of the bed, and then we're going to put this leg into extension and get the leg kind of dropped off of the bed, nice and comfortable. Go ahead and relax your knee there. So even before stretching anything, I like to just make sure my patient is comfortable. And then all we're going to do is internally rotate the thigh as we put a stretch on the hip flexor and ask about any pain or discomfort across the front of the hip. Additionally, some people have posterior hip impingement, and you can perform this same hip extension but with an external rotation and push the greater trochanter towards the ischial tuberosity and see if that seems to elicit any posterior hip pain. And then I will have my patient at this point also lay onto their side, and this sometimes is a better place to palpate into hip pathology, say gluteus medius. Go ahead and bend your knees just a little bit, get yourself into a nice comfortable position, and from here you can better palpate the greater trochanter and especially isolate that posterior facet of the greater trochanter. You can also palpate through the piriformis muscle if that seems to elicit any pain. If they have a piriformis syndrome, you can also perform a Tinel's test and see if that seems to cause any radiation of symptoms down the posterior thigh into the foot. If you have a patient with snapping external hip syndrome where they're complaining of painful popping, clicking sensations on the outside of the hip, you can do an Ober and Noble's test. So with an Ober test, it's more of a stretch of the hip of the IT band here, which it is the IT band that's snapping over that greater trochanter. I get my patient first thigh in a nice parallel alignment with the trunk, abduct them just a little bit and let that IT band contract, and then we will drop their knee towards the bed and see if we can reproduce any of their pain. And then with the Noble's test, you can have your patient imagine they're riding a bicycle and they're going to pedal with just this leg that's up towards the ceiling. Imagine you're riding a bicycle and just pedaling here. You can sometimes palpate a snapping sensation or see if your patient has knee or hip pain in this case. And that could be a snapping external hip syndrome or trochanteric bursitis that also gets irritated in those cases. One last test, if you're at all concerned about piriformis syndrome, I will have you lay flat on your back and you can perform a piriformis stretch test where you bring your patient up. You're going to slightly hyperflex them, adduct, kind of cross the knee across the body, and then internally rotate the femur to put a stretch on the piriformis and see if that reproduces any hip pain or numbing, tingling, radiating pain down the back of the thigh as well.